Arrival on scene to 50-year-old female complaining of difficulty breathing. Got proper PPE for me and my crew. Scene is safe. Number of patients, 1. Nature of illness, difficulty breathing. Additional assistance, going to call for additional ALS support. There's no need for C-spine immobilization at this time. General impression, 50-year-old female seems to be having difficulty breathing. I'm seeing some labored breaths. I'm going to assess level of consciousness. Hi, I'm Jonathan Sheets. I'm the EMT on duty. What seems to be the problem today?
I'm having trouble breathing.
Okay, so chief complaint is difficulty breathing. Airway is patent because they were responding to me. They were talking to me, and the patient responds to verbal stimulation. No life threats apparent. Breathing, I'm going to check respirations. Respirations are about 15 breaths per minute. Breathing seems to be labored, so I'm going to, right now at this time, I'm going to administer some oxygen via non-rebreather mask at 12 liters per minute. Circulation, going to check pulse. Pulse seems to be about 85 beats per minute. Skin looks normal, pink, warm, and dry. And there's no signs of major bleeding. Patient priority, I'm going to say code 2. Going to move on to history taking. History taking. What were you doing when this started?
I was walking up the stairs.
Okay, you were walking up the stairs when this started? Does anything make it better or worse?
Sitting up makes it a little better.
Sitting up makes you feel a little bit better, makes it easier to breathe. Do you have a history of emphysema or COPD at all?
No, not that I know.
What does it feel like?
It feels like someone's sitting on my chest.
Feels like someone's sitting on your chest.
Yes.
About what time did this start?
Like 20 minutes ago.
Okay. Do you have any allergies?
No.
Any medications you're on currently?
No.
Any past medical history that may relate to this?
No.
When was the last time you ate or drank?
3 hours ago.
3 hours ago? Do you remember the events leading up to this?
I walked around the corner and then I started walking up the stairs and it got hard to breathe.
Okay. So I'm going to begin secondary assessment. For secondary assessment, I'm going to assess the pulmonary system. So I'm going to listen to lung sounds. Lung sounds seem to be good. I'm going to palpate around the, I'm going to palpate around the lungs and the rib cage, see if I find anything. Nothing. Gonna lift up the shirt, see if I see any trauma to the area, and I don't see anything. So gonna take vitals, which is including respiratory rate, blood pressure, and heart rate. Heart rate is still about 85 beats per minute. Respiratory rate is staying steady at about 16 breaths per minute. And blood pressure is normal at 120/80. Patient is stable, so I will reassess every 10 to 15 minutes. At this time, we are going to transport the patient to the appropriate facility.